Hello, dear doctors. I'm going to talk about back pain, in which I will cover history and physical examination. Apart from this video, you can use other resources to enhance your knowledge about this topic. So let's start with the first part for the topic back pain in history. So you will start with the appropriate introduction of the patient. Greet the patient, then introduce yourself. Ask the patient how would you like to be addressed, and identifying and confirming concerns list. Then establish a plan for the visit. After introduction, you will go for history, in which same as that we do for other pains. You will go for onset setting, course, duration, place, quality, radiation, severity, 1 to 10, timing of the pain. And you will ask if it's the first time or they had this pain before. Go for alleviating factors or aggravating factors, you can ask, or inquire about any other symptoms if they have. For associated symptoms, just make sure if they had any trauma, if there is any limitation of the movement, any change in walking, any motor weakness in the legs, or any changes in the sensation in the legs, any stiffness in the legs or any other parts of the body. Also, to rule out any systemic disease, ask about eye pain to rule out uveitis and any skin changes as well. We will also go through the review of systems if you find out any positive symptom. And most importantly here, red flags are important to rule out. First of all, if they have any numbness in perianal area or any changes in passing urine, any fever, night sweats. So here we are ruling out quadricula symptoms, any inflammation or any malignancy, for example. So inquire about weight loss, lumps or night pain. For past medical history of the patient, you will inquire about if they have any medical condition or if they had any surgery. And for family history, you will inquire as well. Ask about if they're taking any medication in their drug history, as over-the-counter medications or any prescribed drugs if they are taking. Ask about allergies, if they have any, including drug allergies or other allergies. For social history, smoking, alcohol, drug use, occupation as well. Sometimes they have the occupation which can lead to chronic back pain or even acute back pain as well. See if there is any effect on their activities of daily living. While taking history on this part, always make sure that you notice patients' nonverbal cues, if they are making proper eye contact, if they are nodding head, and how's their body posture. So just make sure that you ask them if they want to add anything else that you asked them before. And ask about their ideas, concerns, or expectations for this visit. Always show empathy while talking to the patient, and avoid technical jargons as much as possible. Summarize the patient at the end if they got it right, what were you asking for, and offer them to answer any questions and thank the patient after you take the history. Coming to the physical examination, you will wash your hands. You will take patient's consent and ask for vitals. So most important, just make sure that you have 3 to 3.5 minutes for your physical examination to complete. First of all, in a physical examination, and there will be general inspection of the gait, wasting, any swelling, erythema, atrophy, scars, any skin or hair changes, or any deformities, or even joint asymmetry, you will look for. And you will see if there is any changes in the ophthalmological examination to rule out uveitis. and also about systemic involvement, including GI symptoms, mouth ulcers, and skin lesions. For palpation, we'll go for temperature, tenderness, and capitation checkup, and see if there is any tenderness around these throughout the spine, cervical, thoracic, and lumbar spine. And after that, examine a joint above and below always. We will examine in that way. Don't forget to do the special tests depending on what diagnosis you are looking for. So these are the lists you can do. These are the resources you can go through. And thank you so much for watching this video, and you can read more about this topic. Wish you good luck.